am super excited to see you today. Some of you might remember me from last year. My name is Kelsey. I'm a dental assistant and I work at Village Orthodontics for Dr. Wall. I love my job, and part of why I love it is being able to visit all of you in the month of February. I visit you in February because February is National Children's Dental Health Month. It allows me the opportunity to connect with your teachers and come talk to you about the importance of taking really good care of your teeth. I'm so sad that I can't be there in person. I truly love this part of my job. I love visiting your classrooms. I love seeing your smiling faces, giving you prizes. I love all of that. But I'm super thankful for technology and allowing me to make a video to share my passion of dental hygiene and taking good care of your teeth with you. Now, I know you guys are used to this kind of learning. I am not. So your teacher's videos are probably perfect. This is my first attempt, so bear with me. If you have any questions at the end, I'm sure your teachers might be able to answer them, or they can email me and ask me anything, and I'm happy to send an answer back. And next year, I can't wait to be in person with you. Does anyone remember how many primary teeth or baby teeth we get in? So our first set of teeth. If you'd like to pause and ask your class, you certainly. I bet you had some really good answers. The correct answer is 20. 20 baby teeth. Now, I like to say that we all have our own tooth journey. So some of us might have less than 20. Some of us might have more than 20. And that's okay. Some of us might lose teeth early. Some of us might lose them a lot later. And that's okay too. That's all part of our own tooth journey. So we get those 20 baby teeth. They eventually wiggle. They wiggle because there's a permanent tooth underneath it that wants to take its place. We get more permanent teeth than baby teeth. Does anyone remember how many permanent teeth we get on average? You can pause me again if you'd like to. I know I heard some really good answers there too. 32. We get 32 permanent teeth. Again, I like to say that very, very lightly. 32 includes all of our wisdom teeth and our full permanent dentition. And like I said, some of us get extra teeth. Some of us are missing some permanent teeth. Something that I like to touch base on because we see that a lot in our office. It's actually really common to be missing a permanent tooth, congenitally missing a permanent tooth. And a lot of times it's hereditary. So if we have that, and a lot of times our mom or dad or grandma and grandpa have that too. And I like to really mention that because we see it so much and to let you know that that's okay. My daughter, who's 10, is missing 2 permanent teeth as well. And if we find that out, we just talk with our dentist or an orthodontist, and we come up with a good plan for ourselves. All right, who knows who the first president of our United States was? You're right, George Washington. A lot of years ago. Does anyone know how many permanent teeth he had when he was president of our United States? 1. He only had 1 permanent real tooth. He used all these other materials to make teeth so he could function and eat and chew his food. But it wasn't George Washington's fault. Everyone was like that back then. We didn't have the research, the knowledge, the tools on how to take care of our teeth. But you know what? We are super lucky because the American Dental Association tells us exactly what to do and how to take care of our teeth. Because the teeth that are coming in right now at you guys' age are going to be the teeth that you have your entire life. So when you get to be your grandma and grandpa's age, or my age, you're going to have the same teeth as are coming in right now. So it's super important to take good care of them from the very start. It's actually best to floss our teeth first. It's better to floss first to remove all the plaque that's in between the teeth, and then we take our toothbrush and we clean up everything after we floss all of that out. So it's best for our teeth if we floss first and then brush. All right, so flossing. Remember, we want to floss first, friends. So we are going to floss first. How many times per day? 1. You got it. If you floss 2 times a day, that's a bonus floss, but you for sure want to do it 1 time per day. Before we get the floss out, we always want to wash our hands, especially this year. We know how important it is to wash our hands. But before we put our hands in our mouth, we want to make sure we get all of the germs off. So let's give them a good wash, and then we'll get the floss. When we take our floss out 1 time per day, we're going to do about the length of our arm. Seems like a lot of floss, I know, but we want to use a clean piece of floss in between each set of 2 teeth. When we place our floss around our fingers, we actually want to wrap our floss around our middle fingers. We do that so our thumb and our pointer can guide and control the floss, so we have full control. So we're going to put a little bit of floss on one side and all the rest of the floss on the other side. I should also mention, we never want to put it too tight around our fingertips because then it doesn't feel very good. So a little bit on one side and a lot on the other side. The side that has a lot is our clean side or unused side. The side that has a little bit to start is going to be our used side or our dirty side. All right, so we are going to start wherever we start consistently again. I'm going to show you in the front so it's easy for you to see. So we have our thumb and pointer, and we are going to seesaw the floss back and forth. We never want to snap it down because that doesn't feel very good. So gently back and forth. Once we get to the base of the tooth or the gum line, we're going to make the letter C. We're going to hold that floss tight against the surface of the tooth, and we're going to go up and down, in and out of the gum tissue 2 to 3 times. Then we're going to go around the other side. Keep the floss tight against the tooth, up and down 2 to 3 times. We'll take it out. We'll put the dirty stuff here, let some new stuff out, go between the next set of 2. We're going to do that all the way around. And even back here, friends, our toothbrush can't get there. So we want to floss behind that back tooth. Every time we take it out, we put the dirty stuff on here, take out some new stuff. Seesaw it again. Form the C around one side, up and down. Form the C around the other side, up and down. Throw the floss away when we are done. We never want to reuse our floss. A lot of my friends might use these. They're little flossers that make it a little bit easier, especially when we're younger. When we are using these, we're going to use the same technique. So we are going to seesaw it down in there, and then even once we get to the gum tissue, we can pull the floss to one side to make that C, and then go up and down 2 to 3 times. Go to the other side, pull the flosser to that side, up and down 2 to 3 times, take it out. I would rinse it underwater. If there's any plaque that comes out, we can get rid of that before going in between the next one. Same thing, make the C, up and down, make the C, up and down. Same with these. We never want to reuse these flossers. When we're done, we toss them. So let's talk about brushing. Does anyone remember how many times a day we want to brush our teeth? I hope I heard 2. Does anyone know how many minutes we should brush for? I hope I heard 2 again. 2 minutes, 2 times a day is what the American Dental Association recommends for brushing our teeth. Of course, if your dentist tells you anything different than I'm telling you, always follow the lead of your general dentist. I am just telling you what the American Association of Dentistry tells us to do to take care of our teeth. So we are going to take our toothbrush. We always want to have soft bristles on our toothbrush. Very, very, very important. Ideally, we want to change our toothbrush every 3 months if we are able. If we're unable to do that, that's okay. But for sure every 6 months. We usually go to the dentist every 6 months anyway, and we get a new toothbrush. But ideally, if we can, changing that toothbrush every 3 months. And again, when we change it, we always want soft bristles. Does anyone remember why? So we want to use soft bristles because our teeth, what you can see outside the gum tissue is the crown of the tooth. What is underneath the gum tissue, you probably remember me showing this, is the root of the tooth. So if you know fractions, some of you might, if we split the tooth up in thirds, 2/3 of the tooth is the root and only 1/3 is the crown. So there's a lot of our tooth that's underneath the gum tissue that we can't see. And you know what, friends? If we brush too hard, that gum tissue is going to start to go away, and that's what we call recession. Recession doesn't feel very good, and it can cause a lot of trouble. So we definitely want to avoid that recession from happening. So we want to brush well. We just don't want to brush too hard. So we are going to start wherever we normally start. Just make sure you get in your own pattern, your own routine. Our soft bristled toothbrush, we're going to put just a little bit of toothpaste on our toothbrush. Does anyone remember how much to put on? Do you guys know the size of a pea, a little green pea that we would eat, vegetable? That's how much we want to use. We don't want to use too much toothpaste because we never want to swallow our toothpaste. And if we have too much on there, it can get really foamy and we won't be doing the best technique. So we just want to use that pea-size amount. We are going to start wherever we normally would start. We're just going to be consistent with it. We're going to angle our toothbrush towards the gum line. We want that nice angle to make sure that we clean all the plaque on that gum line. We're going to do 2 to 3 teeth at a time, 3 to 5 circles. We're going to gently massage the tooth, do those 3 to 5 circles, and then sweep away. We're going to keep going through 3 to 5 circles, sweep away. Again, 2 to 3 teeth at a time. We're going to do all the way around the outside of our upper and lower teeth, and then we're going to do the same on the inside. Angle the toothbrush towards the gum line, 2 to 3 circles, 2 to 3 teeth, 3 to 5 circles, sweep away. Once we get to the front, we're going to do what's called the heel toe technique. So we're going to use our toothbrush up and down like this and gently scrub that surface as well, making sure we hit the heel and the toe of the toothbrush just like it was a shoe, heel to toe. Make sure we get that full surface, top and bottom. And then, friends, the chewing surface is probably one of the most important parts we can clean. There's these little pits and grooves in all of these teeth in the back, or what we call the posterior. Plaque and sugars like to hide in those grooves. If you take your tongue right now and feel those teeth, you can kind of feel those grooves. So it's important that we take our toothbrush and we scrub over those very, very well to clean all those pits and grooves. Sometimes our dentist might add a sealant to our teeth, which is a tooth-colored material that just goes on over the top of the tooth to make those pits and grooves not so deep. It's a great thing to do to help prevent cavities. So we brush the outside, we brush the inside, we brush the chewing surface. Is there anything else in our mouth that we should brush? You're right, our tongue, which mine doesn't have, but typically there would be a tongue here. It's very, very important that we brush our tongue. So we take our toothbrush and we scrub our tongue and even the roof of our mouth. If you've never brushed your tongue before, please be careful. And not brushing our tongue, fun fact, can be a big cause of halitosis. Does anyone know what halitosis means? Bad breath. We don't want that. So we want to make sure that we stick our tongue out, take our toothbrush, and brush over our tongue. So let's talk about food and drink choices. Very important that we make good choices for our body and our teeth. We are given our body and our teeth, and it's our job to take good care of them so we can have them our whole life and maintain a happy, healthy life. So what are some good food and drink choices, friends? Yes, I bet I heard carrots. I bet I heard apples, bananas, celery, things like that are super healthy for our teeth. My favorite one, water. So it's really important to drink a lot of water because when we drink a lot of water, we produce a lot of saliva. When we produce more saliva, it makes it harder for sugars to stick to our teeth. So water's a great one. Milk is another good one. Sometimes I hear apple juice is a good one. Do you think that's a good one? No, apple juice, a lot of juices can be filled with a lot of sugar, so we got to be careful with that. Sometimes I like to tell people if we do have juice, it's really good to mix half juice and half water to dilute it a little bit because there can be benefits to having apple juice. I just wouldn't make that choice every day. and often because it can have a lot of sugar. So we should try to read our labels, and if we need help, I'm sure our parents will be there to help us out. How about some foods and drinks that aren't so good for our teeth? I bet I heard candy, cake, cookies, sugar gum. Friends, that's when I really like to talk about. Sugar gum can have a lot of sugar in it, and you're constantly chewing that sugar onto our teeth, exposing our tooth to that sugar every time we chew. So it's important. If we have gum, I would really recommend that we try to do a sugar-free gum. You know what else, friends? Sports drinks. Gatorade, Powerade. I coach hockey too, so I know that it's really good sometimes to get those electrolytes, but sometimes they can have a lot of sugar, so we want to be careful and not have them too often. And what I also like to tell friends is if we do have something for a special occasion, if we have a soda pop or a Gatorade, or it's Valentine's Day if we celebrate that, and maybe we have a lot of candy, I like to tell friends to do a bonus brush. What a bonus brush is, instead of waiting until nighttime to do your brush, you do it as soon as you get home or as soon after you have that treat or snack. It's not going to take away the nighttime brushing, because the nighttime brushing is the most important brush that you'll do. But when we eat foods that have a lot of sugar, the sugar sticks to the tooth. And when it sticks to the tooth, it's going to start to eat away the tooth surface and could cause a hole in the tooth, which is what a cavity is. So we want to avoid those foods. And if we have them, we want to brush that off. Because if you think about it, I know this is a really young way to think about it, so forgive me for the older grades. But if you think about a ladybug on a leaf, and the ladybug is hungry, so the ladybug's slowly starting to eat the leaf, you'd start to see a hole in the leaf. Can you picture that? Well, it's kind of like a cavity. When the cavity and sugar sits on the tooth, the sugar is like the ladybug and our tooth is like the leaf. The sugar slowly starts to eat a hole into the tooth surface, which is called a cavity. So if we can get in there as soon as we can, after we eat our sugary drink, when we brush our tooth, it's like we flick the ladybug off the leaf, get rid of it so it can't make that hole in our tooth. And it's important, if we do that bonus brush, to do a good job. And again, it doesn't take away the bedtime brush. The bedtime brush is the most important brush that you'll do. You sleep at night, and it's important because we're not creating as much saliva when we sleep. So our teeth are sitting there kind of drier. So it's very, very important that the nighttime brush is the most important, and you do a really good job. But if we have something with a lot of sugar, get that bonus brush in. Pop. I forgot to talk more about soda or pop. So I know this can be really good on occasions, friends, but we never want to get in habit to drink pop or soda often. And if we have a pop or a soda on a special occasion, I want you to remember this quote. Sip all day, get decay. Who remembers what that means? I hope some of you did. What that means is when we have a pop, it is better to drink it in a shorter amount of time. Because when we drink our pop, once we're done, that sugar and acid from the pop is going to attack our tooth for 6 hours after we drink it. So if we drink our pop in a half hour, the sugar and acid is going to attack our tooth for 6.5 hours. But let's say we enjoy our pop and we're going to make it last all day. We are going to sip our pop for 6 hours, just slowly throughout the day and make it last. So now we have that 6 hours plus the 6 hours. So that sugar and acid will attack your tooth for 12 hours then. So do you think it's better for the sugar and acid to attack for 6.5 hours or 12 hours? You're right, 6.5. So if we have a pop, it's better to drink it in a shorter amount of time. And the sooner we can get in there to brush after and do that bonus brush, we stop that attack on the tooth. So it's important to go to the dentist because the dentist or the hygienist is going to clean your teeth better than you can clean your teeth. So sometimes when the plaque gets hard and turns into calculus, we can't remove it. So the hygienists use special instruments and tools to get them nice and clean for us. They also check on our gum tissue to make sure our gum tissue is healthy, to make sure there's no cavities forming anywhere, to take little x-rays of our teeth. How many of you guys have had x-rays? Awesome. So x-rays can detect things that we might not be able to see, we might not be able to feel. And it's a lot easier to fix a cavity when it's small than when it gets bigger. So this is our, wrong side. This is our tooth. This is a happy, healthy tooth. You see all the different layers in it. The outside layer is the strongest layer. It's called enamel. Enamel is the strongest material in our body. And then it's got different layers and it goes all the way into the root of the tooth. So you can see that there's a lot of our tooth that's underneath the gum tissue that you can't see. That's kind of cool. This is a not so healthy tooth. Look it, it's not happy, is it? So friends, this is a little cavity starting here. This is a bigger cavity. And this is a really big cavity that goes way down. And you know what, friends? Sometimes when the dentist takes x-rays, he or she can find a cavity when it's small like this. And it's a lot easier to fix a little cavity like this than let it get deeper into the tooth. So it's important for them to take those x-rays and check up to make sure our teeth are happy and healthy. I only have one more thing I want to talk to you about. You guys are being such good listeners. I'm so impressed. One thing that is super important, so I work in an orthodontic office where we straighten teeth and we make bites fit together really good so we can keep our teeth for a really long time happy and healthy. But one thing at an early age that we look for is sometimes we might put some things in our mouth. It might be our thumb in our mouth. That might be comforting for us. We might bite our nails a lot throughout the day. We might get nervous and put a pen in our mouth. And when we have something in our mouth constantly, friends, what happens is our teeth are supposed to come together. And when we have something in there all the time, they start to kind of grow apart in the front. It's called an open bite. And it kind of looks like this. So the teeth come together in the back, but in the front there's that gap, there's that space. And it might not seem like a big deal, but it makes it really hard to bite into things. And it doesn't allow us to function or our teeth to work like they should work to help us chew our food. And it can be really, really, really hard to stop putting our thumb in our mouth. And we might need help and support. But it is really important, if we are one that puts something in our mouth, that we try to not do that. Because if we take that out of there, our teeth are going to naturally come back together and then help get that biting surface. So if we are one that does that, we really want to try. And if we know someone, maybe a brother or a sister or a friend, if we can be extra encouraging to them to help them to try to stop doing that so they can have a good bite that comes together too. I think that's all I have, friends. I hope you have the best day, and I hope you take really good care of your teeth. Thanks for listening, and I hope to see you in your classroom next year.